Good morning, Professor Green. This morning I'm going to be doing, this is Yelisa Cordero, I'm sorry. I'm going to be doing my MedPass checkoff for you. And the first thing I would start out by is assessing my patient, doing my first initial assessment with my patient, and making sure I have some vitals. Today's vitals are 120/80, heart rate 84. And my patient, it has a pain level of 8. So we will be giving my patient Dilaudid, which is on her MAR for PRN use, depending on when was the last time she had it. I will also be giving my 9 o'clock meds because it is now 8:05. And I will start out by explaining to you which each med is and pulling my meds from the Pyxis. So the first medication that I will be giving this morning is aspirin 325 milligrams. It's a chewable tablet for this patient. And I'm going into my Pyxis and I am checking that this is aspirin 325 milligrams, checking my expiration, which is 10/22, as you can see. And I'm going to put that in a cup for the patient. Now, this is an antiplatelet medication, so this medication is going to assist my patient who has hypertension and diabetes mellitus and also suffers with seizures to not form any clots as she is laying in bed for a long time. The next medication I will be pulling is metoprolol, which is also known as Lopressor. This is a beta blocker, and this medication works by blocking the action of the natural chemical in our bodies, like epinephrine, basically any of these chemicals that can cause a sympathetic response, and it blocks it. The way this is going to help my patient is by blocking any raising in her blood pressure. It's used for blood pressure, which my patient has uncontrollable hypertension. And one thing I would really be assessing with my patient is her heart rate, just because one of the side effects of metoprolol is that it could decrease the patient's heart rate. And I wouldn't want to give the medication to the patient if she does have a low heart rate. My patient, sorry, I didn't tell you who my patient was. My patient is Mrs. Maria Gonzalez, and her date of birth is 6/24/1969. She, like I said earlier today, her blood pressure was 120/80 and her heart rate is 84. So it's okay for me to go ahead and give her that metoprolol. So I am going to be pulling the metoprolol from my Pyxis. And right here I have the metoprolol. I am checking that it is the same as my MAR, which it is. It's Lopressor. We have the generic brand, the generic version instead of the brand. We have Lopressor 50 milligrams, and the expiration date is 10/22, so it is not expired. And I'm going to put this in a separate cup as I am going to inform the patient that we are checking her blood pressure. The next medication I will be checking is for Dilantin, and it's Dilantin 200 milligrams PO daily. With Dilantin, there's a couple of things that we need to think about, but Dilantin is an antiarrhythmic, and it can also be an anticonvulsive. It's usually used as an anticonvulsive, but on certain occasions, doctors do use it as an antiarrhythmic. It limits and prevents, in this case, my patient does suffer from seizures, and she did hit her head. She did fall and break her arm. So we are giving it to her for that case, for her seizures, just to prevent any issues. With my patient, it is going to limit and prevent any seizures by altering the transportation of ions in her body. And I'm going to be pulling that for you. I have Dilantin in my Pyxis, but I have Dilantin in 100 milligrams. In 100 milligrams. So because the order is for 200 milligrams, I will be giving the patient 2 tablets. I also will be giving my patient some insulin. Now my patient has an order for insulin NPH, which is 5 units. And then my patient has regular insulin, which is on a sliding scale. My patient's sugar this morning was 280. And so if my patient has a sugar of 280, when it comes to the regular, we will be drawing up 6 units, as it says on my MAR. So I'm just going to go ahead and show you how I would pull that up. I have my insulin syringe here, and this is a 0.5 ml syringe. Now, when it comes to NPH and regular insulin, the way of mixing it is you would put air into the NPH first. So I'm going to go ahead and show you that. I'm going to get my alcohol swab. And I'm going to show you, I wrote NPH on here. Actually, just for purposes of the checkoff, I'm using the sodium chloride that we brought. I would not do this in real life, but I didn't have any other vials here, so I'm going to use this as my NPH and then as my regular. You would clean your vials. All right, so for my NPH, because NPH has a set amount of units, I will be drawing up 5 units. So first, I will be putting in 5 units of air into my NPH. I don't know if you can see, but that's 5 units. And I would just be injecting the air. Air has been injected. Then you're going to inject the amount of units you're going to withdraw of the regular. So the amount of units that I will be drawing up of the regular is 6 units due to my patient's blood sugar being 280, and the sliding scale says we'd be giving 6 units. So I pull it back to 6. Not sure if you can see it. And I will be injecting the regular with 6. Then what you're going to do is you're going to draw up your 6 units of regular. As you can see, not sure if you can, it's kind of blurry, but it is right on 6 units. Then you would go into your NPH and you will do the 5 units of NPH. So in total, we will have 11 units in the end of insulin. Not sure if you can see that. I wish it would focus a little better, but it is right on 11, right underneath the 10. And that would be the insulin I am giving to my patient. I'm going to put it right here with all my meds for my patient. And for the purpose of the checkoff, I will be using the sodium chloride again for my Dilaudid. So our ordered is for Dilaudid 1 to 2 milligrams IM. every 3 to 4 hours, PRN for pain. My patient is in pain and her scale was at a 8 from a 1 to 10. So we will be giving her 2 mLs of Dilaudid. And this is the Dilaudid. Once again, because it is a different medication, I will be cleaning trash. And then I will be drawing that up. And when giving an IM injection, you can use a 1.5 or a 1 to 1.5 inch needle. And the gauge is usually 22 to 25. So this is an 18 because I don't have anything else, but we're going to say that it is a 23. So I'm giving 2 mL, so I am pulling back the air, injecting my air, and pulling back. Right on 2. And then I always change the needle before injecting the patient. So I will put this in my sharps bin, just because the needle can become dull. And that is the worst feeling, to have a dull needle try and go into the muscle. So then I switched it out for another 23. And I am going to put a little tape on here. Which I will write that it is my Dilaudid on here. And just so you can see, 2 mLs. All right, once I have pulled everything out of my Pyxis, I'm just going to re-verify that I have all the medications correct before I walk into my patient's room. I will also be checking it on my MAR. I already checked it on my MAR, on my Pyxis, but I will recheck it on my MAR just to be on the safe side. So the first thing we are giving to my patient is the aspirin, like I said, because my patient is laying in bed for a long period of time. We want to prevent any clots from happening and the patient developing any DVTs or anything like that. So yes, I have aspirin 325. It is not expired. And I will be giving my patient 1 tab, and it is chewable. And the reason why we're giving it to the patient chewable, or I wouldn't say the reason, but the difference between the chewable and a pill that is being swallowed is just the absorption is quicker, just because it's being absorbed through the mucus glands, and it's more like if it was being absorbed venous, like if it was an IV. So then the next one we are doing is the metoprolol, which is low pressor, 50 milligrams. And we have what we have on hand is the 50 milligrams. It is not expired, so I'll be giving 1 tab. Then the next thing I will be giving to my patient is Dilantin. And we have an order for 200 milligrams. What I have on hand is 100 milligrams. It is not expired. It is for my patient, Mrs. Maria Gonzalez. And because it is 100 milligrams, I will be giving 2 tablets. Then I will be giving 11 units of insulin and 2 mLs of Dilaudid. I am now going to walk into the room and show you how it is that I would address my patient and inform my patient about their medications while administering. Position this to my patient. Sorry if you can't truly see me. I'm going to be using my son's Spider-Man as my patient. So I would be walking in with my orders and with my medications to my patient. Would wash my hands as soon as I get into the room and put on my gloves. I would then introduce myself to the patient. Hi, good morning. My name is Jelly. I was just here a little bit ago. I'm your nurse. I'm here to give you your morning meds. Is that okay with you? Yes, that's okay. Perfect. So we have a couple of medications for you today. Can you verify your date of birth and your name for me? Maria Gonzalez, 6/24/1969. I'm checking on my patient's wristband to make sure that my patient is the correct patient on my MAR and the patient that is being identified. Everything looks accurate. I will also use my scanning barcode if I have it. Everything looks great. So, Ms. Gonzalez, there's a couple of medications I'm going to give you this morning. I want to start out by talking to you about some of your medications. I went ahead and I redid your vitals just because one of your medications, I need to make sure that your blood pressure and your heart rate is at a normal range, okay? So the first medication I'm going to give you today is aspirin 325. So aspirin 325 is a tablet that we're giving you just to prevent any coagulation and any clots in your body, okay? The next medication that I will be doing for you is your Lopressor metoprolol. And this medication I am giving to you because of your hypertension. Now, your blood pressure today is in a normal range. It is 120/80. And your heart rate is 84. And this is the medication that I told you I needed to make sure that your blood pressure was okay. Now, when you take this medication, I do need to advise you that you need to be a little bit careful when you get up from bed. You want to get up slowly just because this medication can cause a little bit of dizziness, okay? Another thing is I would appreciate if you just give me a call if you do need to get up for any reason, as I am going to be giving you other medications that may make you dizzy also, just to maintain your safety. The next medication that I'm going to be giving you is your Dilantin. So your Dilantin is what you've been taking for a while at home for your seizures. We did a Dilantin level this morning, and you were given an extra dose in the ER. So I just want to let you know this one can also make you a little sleepy. But like I said, I just want you to make sure you call me if you need to get up for anything, okay? And I'm giving you 2 of those because the doctor wants you to take 200 milligrams, which is what you were taking at home, correct? Yes? Okay, perfect. So I'm giving you 2 because I have 100 milligrams. And I'm going to wait for my patient to take all 3 medications. I'm going to make sure that my patient actually swallows them. Now, he also ordered your insulin, okay? So we're giving you 2 different insulins. We're giving you NPH and we're also giving you a regular insulin. And these insulins are fast-acting insulin, so I make sure that I have your medication here, your tray here for you, okay? That way we can eat right after we give you your medication, okay? Now, your blood sugar today was 280, so I do have 11 units of insulin to give you, okay? And then the areas that I would be able to give insulin to my patient would be anywhere where there is subcutaneous fat. So I can do right here, behind the arm, around the umbilicus, upper or lower, nowhere actually near the perimeter of the umbilicus. And we will teach our patient to alternate locations just so that they don't cause that muscle damage. Also, inner thighs, upper back, and upper hip loin area. So with my patient, I would be cleaning his site. I'm going to go ahead and do it in the, this is kind of hard, sorry, in the upper abdomen. So you would just clean the area, hold the fat, subcutaneous fat, open your needle, and inject. The next medication I am giving you is your Dilaudid, and this one's for your pain because I know you're in a lot of pain. Like I said, with your Dilaudid, it could make you really sleepy. So I want to make sure that you please call me if you need to get up for anything, because like I said prior, I'm giving you Dilaudid and metoprolol, and both of those can make you quite dizzy and possibly sleepy, okay? So I'm going to give you your Dilaudid. Now, Dilaudid is an IM injection. So there are different areas that I can give you an IM injection. I can give you an IM injection in your deltoid, in your gluteus, and in the lateral aspect of your thigh, your hip. So that is where I'm going to be doing it today. I'm going to look for your greater trochanter. And I will be giving the medication right in the center of that. So I'm going to be wiping my 2 mLs. I would uncap. I would spread the skin in the area that I am going to give my patient the injection. And I would tell my patient to try and relax as much as they can, just because when patients tighten up their muscles, it can be a little bit harder, not really to get in, but it could be more painful for them. So then I would hold tightly the skin, pull tightly across, and then I would go right in the center and put the injection slowly, but not too slow. I'm giving that injection to my patient. Put a Band-Aid if your patient needs a Band-Aid or anything like that. And then once I have given my injections, I would inform my patient, I'm sorry, I didn't tell you that I looked at the allergies, but I did look at the allergies on my med sheet, and my patient has no allergies, and I should have asked the patient if they had any allergies at the beginning. Once I have done this, I would wash my hand, take off my gloves, wash my hands. I would pull up the side rails. Now, Mrs. Gonzalez, I'm going to be pulling up your side rails just for safety, just because, like I said, the 2 medications may make you a bit drowsy. So I'm going to be pulling up those side rails for you, putting this call light right where you can get it if you need me for anything. Now, don't be afraid to call me for anything that you may need, okay? I'm here to help you get up and for anything else. Then I would exit the room and I would document the medications that I gave, when I gave them, where did I give them. When it comes to the insulin, I would document the site I gave it in, how many units I gave, what the actual blood glucose was. Also with the metoprolol, some systems, some EMR systems ask you for the specific heart rate when you're giving it. So I would document the heart rate of the patient. Like I said, if the heart rate is below 60, we would hold it. And then for the Dilaudid, I would put the patient's pain level, and I would put how much I gave, which was the 2 mLs, what gauge needle I used. I'm not sure if the EMRs ask that now, but the ones I've used do. And yeah, just document every medication that I gave. And that is it. Thank you.